free T4, optional lang po yung test. For free T3, kapag hindi po expected ang result ng free T4. Number 61, when should blood sample for trough drug levels be collected? Ito po yung lowest concentration ng drug. Una po, we have yung peak. Kailan po kinokollect yung sample for determination of peak levels? Depende sa mode of administration. Kapag IV administration, 30 minutes after giving the drug intravenously, 60 minutes after giving the drug intramuscularly, or 1 to 2 hours after oral intake. Trough naman po, ito yung lowest concentration ng drug. Usually, yung blood sample po dito ay kinukuha 30 minutes before giving the next dose. So, immediately before the next dose, usually 30 minutes before the next dose. Correct answer is 61, letter D. Number 62, aminoglycoside and antibiotic. Increased level of aminoglycoside in the serum are often associated with toxic effect to which organ? Adverse reaction of aminoglycoside, it is nephrotoxic and ototoxic. Toxic sa kidney, nephrotoxic, o toxic sa ear, ototoxic. Correct answer, number 62, letter B. Number 63, for lead determination, ano po yung preferred sample of blood? At yung stopper ng tube na gagamitin, TAN. Anong anticoagulant? EDTA. Bakit TAN na stopper ng tube? Kasi ito po yung tube na may pinakakonting lead. So RBC naman po, ano po yung hinahanap natin indicative of lead poisoning? Basophilic stippling. To be specific, mga coarse basophilic stippling. Number 64, identification of the urinary metabolite benzoyl-ergonin would be useful in the determination of exposure to which of the following drugs? Benzoyl-ergonin is a metabolite of cocaine. Correct answer is 64, letter B. Number 65, alam ko nakukulitin na po kayo, what is the major active metabolite of the anticonvulsant or anti-epileptic primidone? Anticonvulsant, anti-epileptic, this is used to treat seizure. One of the metabolite of primidone is phenobarbital. Correct answer is 65, letter D. Number 66, what is the active metabolite of the anti-arrhythmic drug cardiotropic, cardioactive, for treatment of congestive heart failure, procainamide? Metabolite of procainamide is NAPA. Correct answer number 66, letter D. Number 67, which of the following tumor marker is related to the Lewis antigen and increase in pancreatic and gastrointestinal cancer? Cancer antigen 99. This antigen, this tumor marker, is related sa Lewis blood group and elevated in patient with pancreatic and colonic adenocarcinoma, CA99. Correct answer is 67, letter B. Number 68, a 55-year-old male with early stages of prostate cancer diagnosed by biopsy had his prostate gland removed. His PSA prior to surgery is 10 nanogram per ml. Remember, ang normal value po nito ay 0 to 4 nanogram, the reference range. If the surgery was successful in complete removal of the tumor cell, what would the PSA result 1 month after surgery? Ang PSA dito upon removal of the prostate should be 0 or undetectable. So, kapag may value or kapag nakadetect ng PSA after removal of the prostate, this can be an indication of recurrence. Correct answer, 68, letter A. Number 69, what is the unique characteristic of DNA polymerase, tag DNA polymerase used in PCR? Bakit po siya tinawag na tag polymerase? Kasi derived po from Thermus aquaticus. Ang property po ng tag polymerase, it should be heat stable. Kasi ang PCR involves heating or high temperature. Remember, denaturation, yung 3 tests for PCR dati, denaturation and annealing extension involves heat. Denaturation at 94 degrees Celsius, annealing at 50 to 58 degrees Celsius, extension 72 degrees Celsius. So, yung tag polymerase, Thermus aquaticus, DNA polymerase should be heat stable. Correct answer number 69, letter C. Number 70, the detection of DNA from cytomegalovirus and human papillomavirus is typically performed using the hybrid capture assay. What type of assay is hybrid capture assay? During our immuno and micro, na-mention po yung 3 types ng amplification technique. We have the target amplification, signal and probe amplification technique. Ang target, ano po yung example ng target amplification? An example of target amplification is PCR, signal amplification, branch DNA signal amplification, and hybrid capture assay. For probe amplification naman, we have yung LCR or ligation reaction. So yung hybrid capture assay is an example of a signal amplification technique. Correct answer number 70, letter D. Number 71, a Gram-stain sputum shows 40 to 60 squamous epithelial cell along with gram-positive cocci, many gram-negative rods, and many gram-positive cocci in pair using the oil immersion objective. How should the laboratorian report the result for this smear? Ano po yung nakita natin? 40 to 50 yung epithelial cell. Ang sputum po, para maging acceptable for culture, dapat po less than 10 yung epithelial cell. Bakit? Kapag increase po yung epithelial cell sa sputum, ibig pong sabihin ito, saliva ang nakolekt. So, anong remedy po dito? Recollection. So, 71, correct answer, letter D. Do not report. Request another sample because this one is contaminated with mouth flora, probably saliva and not sputum, as evidenced by the large number of squamous epithelial cell. Papaalala ko lang po ulit, bago po mag-report ng negative, dapat 300 fields yung nakita. So, 71, hindi po to sputum, kundi saliva, kasi increase po yung kanyang epithelial cell. 71, correct answer, letter D. 72, which selective medium is used for isolation of gram-positive microorganism? Columbia cholecystine acid agar. This will support the growth of gram-positive bacteria such as Staphylococcus. Correct answer, 72, letter E. 73, what cells are found in bacterial vaginosis? Causative agent of bacterial vaginosis is Gardnerella vaginalis. Sa laboratory, how do we diagnose for bacterial vaginosis? Cytology, sa cytology po, anong hinahanap natin? Mga clue cell. These are epithelial cell studded with bacteria. These are epithelial cell na yung cytoplasm po, punong-puno ng Coccobacilli. For Gardnerella vaginalis, for bacterial vaginosis, we also have the whiff or sniff test, vaginal discharge, plus 10% QOH. Sa whiff or sniff test, ang positive result po ay fishy amine-like odor. And of course, culture, hindi po tutubo sa common na media, saan siya kinukulture? Sa HBT medium. Pag-usapan po natin mamaya, susunod na number na po yung HBT medium. Sa cytology po, anong hinahanap natin? Mga clue cell, these are epithelial cell studded with Coccobacilli in bacterial vaginosis. Number 74, a sample is sent to the laboratory from a patient suspected to have bacterial vaginosis. Which of the following would be an appropriate medium for this sample? Bacterial vaginosis, Gardnerella vaginalis. Sa cytology, pwede tayo maghanap ng mga clue cell, epithelial cells studied with Coccobacilli. Another, we have the WEEF or the sniff test. Vaginal discharge plus 10% KOH or 10% potassium hydroxide. With 10% KOH positive result, fishy amine-like odor. Sa Gardnerella vaginalis po ay hindi po tutubo sa ordinary medium. Saan po siya pinapatubo? Sa HBT medium. Human blood bilayer twin medium will support the growth of Gardnerella vaginalis. Correct answer, 74, letter B. Number 75, beside respiratory tract sample, what clinical specimen is useful for sensitive detection of Legionella antigen? Legionella, example, Legionella pneumophila, associated with Legionnaire's disease, a form of pneumonia, Pontiac fever, a mild form of Legionnaire's disease. Remember, ang Legionella ay kinukulture sa BCYE medium, buffered charcoal, yeast extract. Ano pong pinaka-sample dito? Pwedeng sputum or bronchial wash, but for rapid identification of Legionella antigen, anong sample ang pwedeng gamitin po dito? Urine. Correct answer, 75, letter C. 76. A commercial fisherman who had red sores on his hand was seen by his doctor. Biopsy and culture of one of the lesions was performed. The culture grew an organism with the characteristic listed. What is the most likely organism? Non-hemolytic on back, gram-positive non-performing bacilli, catalase negative, H2S positive, when grown sa gelatin medium, may tissue brush-like growth. Gram-positive, H2S positive. So, H2S positive, ito po yung characteristic ng Erysipelotrix para ma-differentiate siya from gram-positive bacilli. 76, correct answer, letter D, Erysipelotrix. Ang tinutukoy pong condition dito, erysipeloid. Huwag pong malilito, Erysipelas strepiogenes, erysipeloid, erysipelotrix. Inflammatory swelling of the hands and fingers, common sa mga butcher, common sa mga fish vendors. Kaya po pag tinanong butcher's disease, huwag pong kakalimutan, erysipelotrix. Correct answer is 76, letter D. Number 77, the procedure that assures the most accurate detection of mediated oxacillin resistance in routine blood microdilution susceptibility testing against Staphylococcus aureus. MEC-A mutation responsible for MRSA, methicillin-resistant S. aureus, or oxacillin-resistant S. aureus. Correct answer 77, letter D. Use of cefoxitin for testing. Cefoxitin is used for mediated oxacillin resistance in S. aureus. S. aureus with cefoxitin MIC greater than 4 microgram per ml are considered oxacillin resistant. The Clinical Laboratory Standard Institute, CLSI, recommends addition of 2% sodium chloride, incubation at 25 plus or minus 2 degrees Celsius, and incubation for 24 hours when performing susceptibility tests for S. aureus. Again, use of cefoxitin testing. S. aureus with cefoxitin MIC greater than 4 microgram per ml are considered oxacillin resistant. Correct answer is 77, letter D. 78. ESPL producing isolate, extended spectrum beta-lactamase producing organism. Sino pong halimbawa nito? Yung mga Enterobacteriaceae should be considered resistant to which of the following antibiotic. Ang palatandaan po dito, CAP. Yung mga ESBL producing organism are resistant to beta-lactam antibiotic. Examples are cephalosporin, penicillin, and aztreonam. Correct answer is 78, letter E. Number 79, which of the following combination is useful for confirming the presence of extended spectrum beta-lactamases in Escherichia coli. Correct answer is 79, letter B. A beta-lactam antibiotic and clavulanic acid. ESBL, extended spectrum beta-lactamases, are inhibited by clavulanic acid. Confirmatory of the presence of ESBL are based on the enhanced activity of beta-lactam antibiotic when it is tested with clavulanic acid compared to the activity of this antibiotic when tested alone. So, beta-lactam plus clavulanic acid to confirm ESBL. 79, correct answer, letter B. Number 80. Which group of molds can be ruled out when septate hyphae are observed in a culture? Septitis or fungal hyphae with cross walls or division. Lahat ng fungi ay may septate hypha except for the zygomycete. So, pag tinanong po tayo, with a septate hypha, ano pong answer dito? The zygomycete. Huwag pong kakalimutan. Correct answer number 80, letter B. Number 81. Which of the following terms is used to describe an increase in lymphocyte and other mononuclear cell in CSF and a negative bacterial fungal culture? Ang tawag po dito ay aseptic meningitis. Aseptic meningitis kasi wala pong tutubo na bacteria or fungi kapag kinulture at ang most common cause of aseptic meningitis are the enteroviruses. Correct answer 81, letter B. Number 82. The test of choice and most sensitive assay for use with CSF to diagnose aseptic meningitis caused by enterovirus. Aseptic kasi po wala pong aseptic kasi wala pong tutubong bacteria or fungi. Most common cause of aseptic meningitis are the enteroviruses and most sensitive assay for enteroviruses is the PCR. Correct answer 82, letter B. Number 83, internal autoinfection sinus is possible with Cryptosporidium and Strongyloides turcoralis. Correct answer 83, letter C. Huwag kakalimutan po Cryptosporidium and Strongyloides. Correct answer 83, letter C. Number 84, eye infection with the Acanthamoeba have most commonly been traced to contaminated contact lens care solution. Ito po yung mga homemade saline-based contact lens care solution. Correct answer 84, letter C. Number 85. The disease most commonly associated with Acanthamoeba is keratitis, associated with contaminated contact lens care solution. Correct answer 85, letter B. Number 86. Oocysts of Cryptosporidium can be detected in stool sample using, remember, ano yung concentration technique for Cryptosporidium? Sheeter sugar flotation technique. Stain for demonstration, we have yung modified acid fast and fluorescent stain. Correct answer 86A. Again, Cryptosporidium, common siya nagkakos ng diarrhea sa mga patient na immunosuppressed, for example, yung mga patient with HIV. Concentration technique for Cryptosporidium, we have the Sheeter sugar flotation technique. Anong stain for demonstration? We have the modified acid fast stain. Ano po ang difference nito sa original acid fast? Sa modified acid fast stain, weaker po yung decolorizer. Modified acid fast stain, weaker ang kanyang decolorizer. Instead na hydrochloric acid, similar sa original acid fast stain, meron po siyang sulfuric acid. Kapag na-mention po yung modified acid fast, para sa mga coccidian po to. Ngayon, wala pong sasagot ng ang Cryptosporidium is a coccidia. Wala pong sasagot ng modified trichome. Kapag na-mention naman po yung modified trichome, para kanino po ito? Sa mga micro cryptosporidian. Ngayon po, katulad na na-mention ko, stain for cryptosporidium, modified acid fasting. Pag wala po nito, pwede tayong mag-answer ng fluorescent staining. Correct answer 86A, pero wag pong modified trichrome kasi sa microsporidian po ito. Number 87, CM. An abnormally high urine specific gravity may be seen in which of the following condition? In the presence of radiographic dye, characteristically increase ang urine-specific gravity when taken with a refractometer. Ang urine-specific gravity is greater than 1.040. Kahit may glucose or may protein, hindi aabot ng ganito kataas. So, kapag present yung radiographic dye, ano yung best way to determine urine-specific gravity? The reagent strip. Kasi ang reagent strip po is unaffected by radiographic dye. So, correct answer 87, letter D. Number 88, follow-up question. A routine urinalysis on a urine sample collected from a hospitalized patient reveals specific gravity greater than 100 or greater than 1.050 with the use of a refractometer. The best explanation for this specific gravity result is that the urine contains a radiographic contrast dye. In the presence of radiographic contrast dye, ang best way to measure urine-specific gravity is reagent strip kasi ang reagent strip is unaffected by contrast dye. Correct answer number 88, letter B. Next, number 89, a negative glucose oxidase test and a positive test for reducing sugar in a urine indicate. Ang tinutukoy po dito, negative ang reagent strip, pero positive ang clinic test. Negative ang reagent strip, pero positive ang clinic test. Ang reagent strip po natin dahil enzymatic, specific po for glucose. Ang clinic test, ang precursor po nito ay Benedict's. Ang clinic test is not specific for glucose. It will also detect for other reducing substances. Negative reagent strip, positive clinic test. So this can indicate presence of non-glucose reducing substances such as galactose. Correct answer number 89, letter C. Number 90, a positive glucose oxidase test and a negative test for reducing sugar indicate a true glycosuria or true glucosuria. Ang reagent pad po natin for glucose, hindi lang po siya specific for glucose, but it is also more sensitive to glucose. Pag sinabing more sensitive, meaning it can detect low amount of glucose. So, positive reagent pad but negative clinic test. This can indicate presence of small amount of glucose. Ang reagent pad, hindi lang po siya specific for glucose, but it is also more sensitive to glucose, meaning it can detect small amount of glucose. Correct answer number 90, letter A. Hanggang dito po muna ang discussion. Check for the next video. Salamat po.